Also happening now at 5:30, an upcoming deadline that impacts all of us. The public health emergency that Congress declared back in 2020 is set to expire on January 16th. The Secretary of Health and Human Services has been extending that deadline in 90-day increments, but has not yet issued the latest extension. Among other things, the emergency offers more flexibility to Medicare patients to receive telehealth help.
It means that there are no in-person requirements for the online prescription of certain controlled substances, which have made it easier for folks seeking mental health assistance or substance use disorder assistance to be able to receive those services through online prescribing by connecting virtually with a licensed medical provider.
No surprise, telehealth services for everyone have exploded during the pandemic. According to the American Telemedicine Association, there's been up to 38 times more virtual visits now just in 2022 compared to the beginning of 2020. And with COVID cases surging due to the Omicron variant, experts believe these kinds of visits will remain popular.
So, how are our local hospital systems handling the volume? News 5's Jay Jarvis spoke to leaders to find out.
It's about trying to get people the appropriate care as quickly as possible from a provider's perspective.
At Metro Health, Director of Telehealth Operations Albert Ferreira says providers are handling thousands of virtual appointments weekly. And over the last couple of weeks, he says there's been a significant increase as people shift from in-person visits to telehealth, likely due to the Omicron surge, but also because it's easy.
We're seeing a lot more patients that are more comfortable being at home and having the convenience of being able to talk to their provider from home.
He says the impact of the volume on providers largely depends on which department they're in, like urgent care, which requires more time spent with patients. But overall, he says they're handling it well.
We're far more prepared than we were, obviously, in 2020. We've adapted to a lot of our processes, the technology components.
University hospitals also handling a high number of virtual visits, from more than 400,000 in 2020 and more than 300,000 in 2021. Compare that to 2019, when there were just 10,000 virtual visits.
We're finding different ways to reach patients.
Dr. Brian Zach, medical director of telehealth for UH, says over the holidays, wait times were longer than they'd like due to the volume, but that overall, telehealth actually helps take the strain off other departments.
It's given the emergency room more time to see the sicker patients quicker and to really take care of those who need that higher level of care in the most appropriate setting.
And makes it more convenient for patients to access the care they need.
Our psychiatrists and our psychologists are over 93% virtual. Compliance in the patients, though, is up significantly. No-show rates is down over 30%.
We are far better off as a society and as a healthcare industry by leveraging the tools and technologies that we have available to us and not being afraid of them.
Jade Jarvis, News 5.
The American Telemedicine Association expects the Biden administration to extend the public health emergency soon. In the meantime, Congress is working to make the telehealth extension permanent for Medicare and Medicaid beneficiaries.